Food. Heart health. Eating cranberries every day keeps heart disease away. Study says March 23, 2022 London. Cranberries are famous for their distinct tart taste. However, new research by a team at King's College London suggests this delicious fruit should be just as synonymous with healthy hearts. Scientists report eating just 100 grams of cranberries per day contributes to particularly robust cardiac functioning in healthy men. Even better, the cardiac benefits of cranberry consumption appeared almost immediately. A group of 45 healthy men took part in this project. Half the group consumed whole cranberry powder equivalent to 100 grams of fresh cranberries per day, 9 grams of powder, while the second half took a placebo each day. Both groups ate their assigned food item on a daily basis for 1 month. The participants assigned to the cranberry powder group displayed notable improvements in their flow-mediated dilations, FMD. Study authors say FMD signals both heart and blood vessel function improvements. Scientists consider FMD an important and sensitive biomarker of one's cardiovascular disease risk, measuring the widening of blood vessels when blood flow increases. Immediate benefits with long-lasting results. It's also important to note that the FMD improvements among participants were apparent within just 2 hours of consuming cranberry powder, with the beneficial effects remaining after 1 month of daily consumption. This suggests eating cranberries is great for the heart in both the immediate short term and over the long haul. The increases in polyphenols and metabolites in the bloodstream and the related improvements in flow-mediated dilation after cranberry consumption emphasize the important role cranberries may play in cardiovascular disease prevention. The fact that these improvements in cardiovascular health were seen with an amount x3 of cranberries that can be reasonably consumed daily makes cranberry an important fruit in the prevention of cardiovascular disease for the general public, says senior study author Dr. Ana Rodriguez Mateos, senior lecturer in nutrition in the Department of Nutritional Sciences at King's College London, in a university release. It isn't exactly breaking news that eating more fruits and vegetables in general is good for the heart. Despite that, recent research continues to provide further evidence that the polyphenols found within berries have a strong connection to healthy hearts. Cranberries in particular have an abundant amount of unique proanthocyanidins that offer distinct properties in comparison to the polyphenols in other fruits. Study authors conclude that eating roughly 100 grams of cranberries per day likely reduces the risk of developing cardiovascular disease by strengthening blood vessel function. Our findings provide solid evidence that cranberries can significantly affect vascular health even in people with low cardiovascular risk. This study further indicates that specific metabolites present in blood after cranberry consumption are related to the beneficial effects, adds study co-author Dr. Christian Heiss, professor of cardiovascular medicine at the University of Surrey. The study is published in the journal Food and Function. Tags: cardiovascular disease, cranberries, fruit, heart. Cup of leafy green veggies, even in a smoothie, a day keeps heart disease away. Joondalup, Australia. Need more convincing that you should add leafy green vegetables to your daily diet? Not only are they good for the muscles and waistline, a new study reveals they're also good for the heart. Researchers in Australia find nitrate-rich vegetables, leafy greens and beetroot, lower blood pressure and the risk of developing heart disease. A team from Edith Cowan University says consuming just 1 cup of raw leafy greens each day can result in a 26% lower chance of heart disease later in life. The nitrate-rich foods include spinach, broccoli, lettuce, cabbage, and kale. Study authors examined records from over 50,000 people in Denmark, taking part in the Danish Diet, Cancer, and Health Study. These records tracked each participant's health and dieting habits for 23 years. The results reveal those eating the most nitrate-rich vegetables lowered their systolic blood pressure by 2.5 mm Hg. This number is the first or upper number in a blood pressure reading. It shows how much pressure someone's blood is applying on the artery walls when the heart beats. Additionally, researchers discovered participants eating the most leafy greens had between a 12 and 26% lower chance of cardiovascular disease. Our results have shown that by simply eating 1 cup of raw, or half a cup of cooked, nitrate-rich vegetables each day, people may be able to significantly reduce their risk of cardiovascular disease, Dr. Catherine Bondano says in a university release. The greatest reduction in risk was for peripheral artery disease, 26%, a type of heart disease characterized by the narrowing of blood vessels of the legs, However, we also found people had a lower risk of heart attacks, strokes, and heart failure. Supplements are not necessary, although the dietary supplement market may be big business in many countries, including the United States. Researchers say you simply don't need them to get your fill of leafy greens. The study finds 1 cup of nitrate-rich vegetables is the ideal amount to eat each day. Researchers did not find any added benefit of going over that amount when it comes to heart health. People don't need to be taking supplements to boost their nitrate levels because the study showed that 1 cup of leafy green vegetables each day is enough to reap the benefits for heart disease, Dr. Bondano explains. We did not see further benefits in people who ate higher levels of nitrate-rich vegetables. Rather have a smoothie. Go for it. If sitting down and chewing away on a bowl of veggies just isn't your thing, there are other ways to get those nutrients. The study authors suggest including a cup of vegetables like spinach in a fruit smoothie. Blending leafy greens is fine, but don't juice them. Juicing vegetables removes the pulp and fiber, Dr. Bondano adds. The findings are the latest work from Edith Cowan University highlighting the benefits of leafy greens. Researchers at the school previously reported on the benefits of spinach and other leafy vegetables for muscle health. That study revealed nitrate as key nutrient which improves muscle function, especially in older women. The study appears in the European Journal of Epidemiology.